A lot of people ask me what kind of fillers I use, and I would say that it is important to have the artistry to deliver awesome work. It is just like right now I'm into portrait painting, and it's not the pastels I buy or the color pencils I buy, although I always buy professional grade. It's how I apply that to a canvas or onto a paper that will deliver the results. So to me, fillers are much more about artistry than they are about just what kind you use. However, what kind you use lends itself towards safety. So in general, I prefer hyaluronic acid products. The exception right now is I do like Radiesse in the hands because it offers me a much less expensive avenue to get great hand results, and I like the way it looks in the hands. But in the face, I like the concept of reversibility first and foremost. So I've moved away from permanent fillers. I've had issues with permanent fillers in the past, and I've found that these quote-unquote temporary fillers have actually gotten really ability for long lasting, and I've seen as long as 20 years. I was doing a lip correction on a patient, and I saw that some Restylane came out, so I was a little worried that she just had that done. And she said, no, I never had it. Then she recalled, oh yeah, 20 years ago I had a syringe done in Europe before it was even approved in the United States. I had a gentleman that had weird little pockets of fillers under his eyes, and he had been to 5 different doctors, and they all said, sir, if you had one syringe 5 years ago in Chicago, there's no way this could be a bad filler. It's something else. And I said, no, it's filler. It's still there. So I dissolved it out, and within 3 hours, he was happy. Another lady had a filler in her lip, and she said, what is this bump? And I said, did you have filler before? She said, yeah, 7 years ago I had a filler, but it's, it's some Restylane. And so I said, it's filler. So I dissolved it, and within 4 or 5 hours, it was normal. So I like reversibility. And as you can hear from these anecdotes, there's actually incredible longevity as well. I like to say I like to use old and cold fillers. So what that really means is I like fillers that have been around for 20 or 30 years. I don't like second, third, fourth generation fillers. I see no benefit in getting newer generation fillers. They do not perform better. The performance is in my hands. The performance is in my design, not in the product itself. However, I do say that a lot of newer generation products, and I'm going to try to stay away from naming products just for sake of trying to be clean with this podcast and not getting in trouble with the companies. But I will tell you, a lot of the second generation products have had significant issues. If you look at the track record in Europe, there are problems that have cropped up even in the mid-2000s that have now shown its ugly head in the United States. So I do not use a lot of second, third generation products from almost any company. I think there are more risks to them. It's maybe a subtle risk, but I have seen some serious issues where I've had to correct. Fortunately, not my patients, but other patients that have come to me. And if you just look at the track record, and I will tell you when you come to my office which products I do or do not use and why. So I like this concept of using old and cold fillers because I think the older the filler, the better.